Nicole Shanahan, who is RFK Jr.'s vice presidential pick, is anti-IVF. Now, this is somewhat not surprising given that she's running mate to someone who's been considered highly sus within the scientific community for quite some time due to his anti-vax propaganda. She has denounced IVF, calling it one of the biggest lies that's being told in women's health today. She's a Silicon Valley attorney and a very wealthy philanthropist who is a huge proponent of and financially backs unconventional research dealing with reproductive longevity, and has a really specific focus on trying to find inexpensive, low-tech ways to improve people's ability to conceive, looking into things like exposure to sunlight. And look, she clearly has a bone to pick. She was interviewed in the New Yorker saying that in her 30s, when she wanted to freeze embryos, she was told she was not a candidate for IVF, and this was due to her PCOS. Now, as a fertility specialist, this doesn't really make any sense to me. I've never told a patient that they were not a candidate for IVF because of PCOS, especially in their 30s. So the story's not checking out. I feel like not being a candidate for IVF is something you might say to someone who's in menopause or if they're too sick to cycle. Anyway, 2 years later, she was able to conceive without the assistance of treatment. She is now this walking paradox. On one hand, she's this Silicon Valley bigwig, very pro-technology, yet she's anti-IVF. She has said over and over that she just wishes that IVF clinics would offer other options besides IVF. Guess what? We do. There is a range of things that we can offer patients before we tell them, okay, maybe it's time for IVF. And it's routine to help people with cycle tracking and timed intercourse, ovulation induction with timed intercourse, ovulation induction with IUI, natural cycle tracking with intrauterine insemination. She has been quoted many times as saying that her own experience with natural childbirth is what's made her anti-fertility clinics, anti-IVF. Well, I'm really glad it worked out for her that she didn't end up needing treatment to conceive, but try telling that to the over 8 million IVF babies that have been born to date, which comprise up to 2% of the US population. I'm sure many of you find this rhetoric triggering. I know I do, especially as it comes on the heels of lots of anti-IVF statements from lawmakers who are very uninformed about what IVF is and why it's done. As a fertility specialist, I'm the first to admit that we need to continue doing research to try to figure out how to test for egg quality and how to improve it, knowing that it is the main link between aging and infertility. And until we figure that out, us experts are going to continue to focus on what we know best, which is how to prevent and treat infertility as effectively as possible with the tools we have available today, while Nicole can continue to invest in and focus on research towards replacing us with tanning salons.